Tonight, St. Mary's Hospital in Lavonia is shutting down its labor and delivery unit, and this leaves some hospital staff out of work and pregnant women having to drive to Athens or Gainesville to find care. Our Alexa Liaco went to Lavonia tonight to see the impact, and Alexa, this is a big concern for so many. You can just imagine what they have to tell you.
It really is scary for a lot of those moms who are now going to have to drive 40 minutes, maybe an hour and a half to get to the hospital. You can imagine an emergency situation that would be really emotional. I spoke with a handful of people also who work at the hospital or know people who do. No one would speak to us on camera because they were worried about their jobs, and even for those who were let go and are now unemployed, they said they're worried about speaking out on this because they still want to find another job. But they did tell me off camera, both nurses and patients alike were surprised and taken aback by the closure of the labor and delivery unit. Patients told nurses that they were scared and stressed out to find care and new doctors. Some nurses told us they worry many low-income patients in that community won't have gas money to drive to other centers for care, which of course could put mothers and babies' lives at risk. One nurse told me that Lavonia is a small town filled with hard-working families, and she says, frankly, she feels like her community is being left behind and forgotten. St. Mary's healthcare system did release a statement to us saying Medicaid cuts were not the only reason leading to this closure, adding that they tried for more than a year to recruit doctors and pursue other funding sources. The statement then goes on to say that recruitment challenges, among others, solidified their decision to make this closure. Now, unfortunately, this is not an isolated incident. Senator Jon Ossoff spoke on rural hospital closures happening across our state. He said 9 rural hospitals have closed in Georgia in the last decade.
And as a husband and the father of a 4-month-old baby girl and a 3-year-old girl, I know well, and you all know well, that if mom is going into labor, the last thing you want to be worrying about is, gee, is it going to take us 45 minutes or an hour and a half to get to an obstetrician, particularly if you got a high-risk pregnancy.
The American Nurses Organization echoing Senator Ossoff's sentiment, saying, quote, when labor and delivery units close, expectant mothers are forced to travel farther for care, putting their health and the health of their babies at greater risk. These are consequences that ripple far beyond one facility or one town. Now, St. Mary's did say that it would help the nurses who were laid off find jobs within their healthcare system, but some nurses I spoke with today said those options don't work for everyone, so many are still left out of a job. One nurse even saying she chose to just retire. So, and also for many of the nurses still working at the hospital, they say they're grateful to still have a job, but many are now having to work longer shifts to cover the gaps. So Sharon, for patients and nurses alike, this is really creating a lot of challenges that many are not sure, how we're going to close those gaps in the months to come.
My heart just breaks for them. Something needs to be done. Hopefully they can talk to their elected officials and something will change. And Alexa, I know you're going to keep us posted.
We absolutely will.
Great story. Thank you so much.